This is an NBC Palm Springs special report. Coronavirus facts, not fear. Presented by East Valley COVID-19 testing site, serving residents of eastern Coachella Valley.
Good evening. Thank you for joining us for this NBC Palm Springs special report, Coronavirus Facts, Not Fear. We dedicate this half hour each day to in-depth interviews with a range of experts and professionals. Because now more than ever, it's vital that we hear directly from our local leaders as we sift through often confusing and rapidly changing information. Well, let's begin with the latest numbers as we end this week. 145 new cases reported in the county just today, 34 here in the Coachella Valley. And there are 10 new deaths to report countywide, 4 in the Coachella Valley. Your city-by-city breakdown looks like this. Indio continues to have the highest case count with 350, but Palm Desert continues to have the most deaths out of the 9 cities, now up to 22. Joining us now, our frequent guest and part-time co-host, Congressman Dr. Raul Ruiz. Thank you, as always, for being here, sir. So much going on in the country today that we could be talking about, but let's stay focused on what is at the utmost concern right now here in the Coachella Valley, which is our continued coverage of the coronavirus and how we're reacting to it. A lot of questions being asked by some of our viewers. Howard in Palm Desert asks why you believe the death rate seems to be so much higher at nearly 12% in the city of Palm Desert. Is there any science to explain this?
Well, the first thing I would do if I had the data in front of me was to determine if there was any statistical difference between Palm Desert and the other cities. And that would clarify if it was something that we can really pinpoint in Palm Desert. And that's a little the public health nerd in me. But the other question is, what are the demographics? Was there an outbreak within a certain assisted living facility, a nursing home? And what are the correlations between the individuals who have died from Palm Desert? We do know that the average age in Palm Desert is higher, and so that may be a cause of that as well, or at least a risk. But you know, it's very difficult to tell without that information in front of you.
All right, we're going to be accelerating phase 2. We haven't got to phase 3 yet, but that seems to be imminent as well. How comfortable with you how California is moving forward?
You know, I'm not very comfortable, Gino, to be honest with you. It makes me very nervous. We don't have the apparatus in place to efficiently and effectively contain a virus or an outbreak. We don't have the contact tracers that we need in the Coachella Valley or in the entire county. And so right now, the county and in some places around the state, we're taking a big risk. And we're hoping that there's not another major outbreak. And so we have to go back and being more vigilant with our personal behavior and personal responsibility to ensure the safety of our family, ourselves, and our neighborhood. It feels like, Gino, that because we're starting to see restaurants open and soon the beauty salons and the barbers, and we're starting to see businesses open more and more. It kind of has the feeling that we're past the coronavirus phase, like it's not around as much. And in some elements, it's not around as much as it used to be, although it's climbing again and it's getting to the point where we're testing more positives, like when we reached a peak before. So it's still around, and we have to just be cognizant that the coronavirus has not gone away, and it could very easily spread rapidly into our communities.
You know, we talk a lot about a second wave happening in the fall when the normal flu season would hit, not dissimilar to the 1918 Spanish flu pandemic. Is it possible, since we know that this particular strain of virus isn't hindered by hot weather, like many virus strains are, that we're not going to see a second peak? We're just going to see a steady climb through the summer and then just maybe more of an explosion in the fall?
Gino, so I've read some of the medical literature and the review articles, especially a review article from the National Academy of Science that precisely looked into that question. And they categorized the parallel studies, or 2 categories of studies. One was the bench study, which is usually done in a laboratory under very controlled conditions, and another is done through case studies of other locations with coronavirus transmissions in the summer. And what they concluded noted is that although there is some evidence that the heat may reduce the replication of the virus over time in the bench or in the laboratory under controlled setting with very high heat, that clinically or real case scenarios that we're still seeing the transmission of coronavirus in the heat of Texas, in Florida, in Singapore, and other countries around the world. So although there is some element of the heat slowing the virus or how long it may last on surfaces, the clinical aspect is that it can still be transmitted, especially somebody who accidentally spits or sneezes, who's infected, and it gets on people's clothes, hands, or face. And so we still need to not lower our guard during the summer. This also raises another point, Gino, and this is very important to note, because a lot of people think that the sun or UV light kills the virus. And the answer to that is yes and no. So yes, under very high intense light or UV light, for a prolonged period of time, you can destroy a virus and disinfect items like masks and other items that you need to disinfect with UV light. However, the sun doesn't provide that amount of UV, and it's also how long you're out and exposed to that intensity of UV light, and the sun is not going to keep you safe.
All right, you're one of a handful of members of the House and Senate that are also doctors. There's only a few of you guys, and you guys were early into this, and it sort of puts a double burden on you because, one, you're dealing with the medical community, you're dealing with medical science. But on the other hand, you've still got to play the politics card of it as well. Let's face it, you got to run for office every 2 years. How are you able to balance those two right now when something as simple as a mask has become a political issue?
You know, Gino, it's in emergency medicine, we're trained to prioritize the danger, the risks of death for patients, and you go down that list and you're laser focused on what you have to do in your protocols to save somebody's life. And I bring that training not only in problem solving, but also in my actions, especially during an emergency like a pandemic. So I focus first, which is saving lives. That means making sure that I raise the bar in accountability with the county, the state, the administration, based on my expertise, my knowledge, and my training to make sure that we have the appropriate equipment in our ICUs, our ventilators, our masks, etc., to help save patients' lives. And then the next is to educate the community so that they have information that will help protect themselves and their family. The second category is to help our businesses and help our individuals weather this storm. It is unfortunate that we have this pandemic, and the more we can support through monetary resources, through information for our businesses and for individuals, the more we can get back to a sense of normalcy and get back to work. And then, of course, the rest is to ensure that we're forward-looking in the legislation that we introduce and that we work. And I have a particular interest in making sure that those with less voice, those that are oftentimes marginalized, those everyday Americans that aren't heard or listened to, have a strong advocate in me. Like I've said, I will fight for the single mom who is struggling to take care of her child and put food on her table. I will fight for the veteran who has been neglected and ignored by the VA and has not had their benefits. I will fight for the senior who has issues with Social Security, Medicare, who is still relying on making decisions whether they pay their medicine or put food on their table. And I will fight for the working poor, or the working families, and the middle class who have recently lost their job, to make sure that they have a source of income so that they can help their families. That is my priority, and that is how I approach my work.
All right, Congressman Dr. Raul Ruiz, thank you as always, sir.
Thank you.
We'll be right back.